Assalamu alaikum again. We have a few participants. We'll wait a few more minutes, but just to run through a few to whoever's in the participants, these are the ground rules. Please keep yourself muted, as in there is a very good panel who will be giving excellent advice, and I want everyone to be an opportunity to hear. If you have any questions, you can ask in the chat box, or if you want to wait till the end, there's a raise hand function on Zoom. You raise your hand and I'll highlight and you can ask the question from any member of the panel or all of the panel. We will try to record this session, but as we've said multiple times, the more people in the session who are interactive, it makes the session more fulfilling for everyone. So please try to attend live and ask questions. This is your opportunity to do so. This is the vision of the IPPA. I'll let you read it. But it is for the benefit of all Pakistani nationals in Ireland. It is to help them progress in their fields and promote us in their society and become an integral part of the structure here as well. So we're all here to help each other. We'll wait another minute or so and then we'll hopefully start this webinar as well, just to give people a little bit more opportunity to join.
Baba, what were you in? Baba.
Okay. So I'll introduce myself and we'll start the webinar. My name is Dr. Adil. I'm a vascular surgeon. I'll be joining as a consultant in Limerick. On our esteemed panel, we have Dr. Waqar Arshad, who is a first-year GP trainee in Sligo, Dr. Mohammed Ghaznan, who is a fourth-year GP trainee, and Dr. Syed Arsalan Naqvi, who's also a second-year GP trainee in Sligo. They have all lots of experience and they have a lot to tell you and explain about the GP practice. It is very valuable information. This is what made the difference between you getting the scheme or not getting the scheme. So I would tell everyone to pay attention and ask questions at the end. These are some of the ground rules that we have set to help with these webinars. Please keep yourself muted so that everyone has the opportunity to listen to the advice and questions. Please ask all the questions in English in the chat box. We will try to reply in the chat box. If not, you can wait till the end of the session where we will do a live Q&A. There's a raise your hand function in Zoom. Once you use that, we'll identify and I'll ask you to ask your question. And it could be to a specific member of the panel or to the whole panel. The session will be recorded, but the more interactive it is more beneficial. So I would highly recommend to attend this session. This is the vision of IPPA. This is a professional body that was established with the vision to raise the respect and honor of Pakistan and Ireland. It is to transform Pakistani values in the current generation. It is to allow a group of professionals in different fields to live and work and cooperate without compromise in Ireland. So we are working together to help everyone and all the Pakistanis promote themselves in Ireland. Now, I will hand over to our first speaker, who is Dr. Waqar Arshad, who's a first-year GP trainee. So he's done the interview last year and is on the GP training scheme in Sligo. Thank you, Dr. Waqar.
Thanks, Dr. Adil. Assalamu alaikum to everyone. And congratulations to all of you for being shortlisted for the interview, first of all. Honestly, it's a big achievement. I know a lot of people who applied for the scheme, and I only know a handful of people who were shortlisted for the interview. So you're almost already there. There are 350 seats this year, and I think only just above 500 people shortlisted for the interview. So the odds of getting onto the scheme are very high. I think the aim right now should be not just to get on the scheme. The aim should be, your target should be to get to the scheme of your choice. That's what you should compete for. In terms of what to expect and what is the format of the interview, a disclaimer first that usually there are some slight changes every year. So my experience was different from the experience of Aslan, and it's always different for different people. So if there is a small change or slight change in your interview on the day, don't get surprised. I will talk about the format that has been communicated for this year for yourself, and then I'll talk about my own experience. So for this year, there are 5 questions with 5 different interviewers for 5 minutes each. And the whole duration of the interview is 30 minutes. So on the day, what you would expect is when the interview starts, you go see the administrator. They greet you, they check your ID. They may or may not ask you to show around the room as well. So make sure that obviously there's no one in the room. And then they will move you on further to the moderator. Now, when you go to the moderator, there may be an icebreaker question or an introduction question. Tell me about yourself. Why GP? How was your day even? Or what does your day usually looks like? So all those kind of questions. And then moving on, you will be moved to a different panel after every 5 minutes. In those 5 minutes each, you will have the first 2 minutes to see the question, to read the question, to think about it, even take notes if you can, bullet points maybe, and then 3 minutes to answer the question. 3 minutes is a very short time to answer any question. So make sure you're on point. Make sure that whatever bullet points you have in your head or on the piece of paper, make sure that you communicate those in those 3 minutes. You will feel rushed during the interview. It will be like a quick fire round in a quiz show. I actually felt like that. And what happens then is you kind of speed up. And if you do speed up, then you can miss things that you wanted to say or that you want to say. So be kind of mentally prepared that you will feel rushed, but make sure that you do not speed up because of that. So 5 questions, and then so admin, then introduction, then 5 questions, and that's it. That's your interview done. In terms of my experience of the interview, I had a fairly I had 3 questions, 3 interview panels. The first question was about the GP land, GP practice. The second question was about the ethical and management issue. And the third question was the clinical scenario. My interview was done within 18 minutes. I did not get a chance to have an icebreaker question or an introduction question. So that's why I'm telling you there may be some slight changes, so don't get surprised. If you do get an opportunity to have an introduction question or an icebreaker question, you may not be able to mention in any other kind of question. So let's say you have done a diploma in something, or you may have done a master's degree, and you may not be able to mention that in a clinical case. So make sure that you use that introductory session or question to kind of highlight that to the interview panels. That introduction session is not marked, but that's where you sell yourself or make an impression. So that was my experience of the interview. And I'll let Razman to follow up with relating the interview to the core competencies. And I think that's the aim of the session. If there's one take-home message, that's probably for Razman to cover.
Thank you very much, Dr. Wakar. That was excellent. And hopefully they'll learn. Dr. Ghaznan will talk about the interview, what it's about, the core competencies, and what to have a look at. So Dr. Ghaznan is a fourth-year GP trainee. He has a lot of experience. So I'll hand it over to Dr. Ghaznan. Thank you.
Thank you, Dr. D. And thanks to everyone, and thanks IPPA to provide me this opportunity to talk about my experience and guide the juniors. So congratulations, everyone. And it's definitely a big achievement for sure, but it's, it's a new door to open, and obviously for your career, and also for the opportunities going forward for yourself and your family. So myself, a very brief introduction that is important. I appeared in the interview for 4 times. So I would be the only person, maybe. I don't want to take pride of it, but I always tell to my, juniors and newcomers that probably it's a good idea to learn from a spider who failed, but eventually succeeded, instead of a tortoise who succeeded because of the lazy opponent. But anyway, everyone has his own experience and, going forward. So I have seen, the interview format being evolved, but in a good way, actually, in a conducive and productive way. So the basic format remains the same, and that is just to check you for your core competence. I will expand to that. What does it really mean, and what are the components? To be very precise, there are 5 different sections that are included actually in core competence, but I have some, I will describe them separately as well. Insight into the GP practice, that is really important, because I would say there would be a lot of people who doesn't have any experience working in Ireland in any clinical avenue, including hospital or in community. So these all informations are available in ICGP. You should have a small, some idea how it works in Europe, and specifically in Ireland. Like there's a primary care, secondary care, and tertiary care. Second thing is professional integrity. Professional integrity means, like, the work ethics. So I think when we are doing our graduation and going forward our internship, and also maybe a lot of people would have their degrees and post-grad, qualifications as well. So we kind of have a rough idea. So it's just like, you have to have a, to follow the code of conduct of that country. And compassion, you have to show you're very compassionate. It's not like you apply for 3-4 different subspecialties and you are just thinking. So just pretend to be compassionate and show your motivation, enthusiasm, and body language is really important. Fourth thing is clinical knowledge. They don't expect that you know everything, that's for sure. But one word is enough, that is a safe doctor. Safe doctor is a logical thing that, like, as intuition, any person who has graduated would think, like, this is chest pain, okay, maybe I need to send this patient to the hospital, or this is a flu, it's just like it's a viral infection. So simple is that. So go by your intuition and your experience, and also, like, just by the, the way the question is asked. Fifth thing is communication or interpersonal skills. We can talk for 3-4 hours on it, but communication is important. But obviously you'll learn gradually, but try to be precise and like when you focus on the question, just maybe at least 1 or 2 sentences you have to throw to start. You should have them in your mind. So now I'll elaborate more about the core competence, other sections in the next slide. So, just to give you some idea about the GP as a general practitioner, general practitioner actually covers different aspect of patient's life. Very like honestly speaking, even working in the community, after the priest, they consider GP their family member and the person who harness their interest in the society, in the community, in this, for the psychosocial medical aspect. So in the interview, they will definitely, when they will present you the scenarios, they would be thinking this candidate is focusing on all the aspects, not the medical aspects. So that is very important. And obviously, a GP is also managing the GP surgery. So he has to be a good manager, but I don't want to complicate the things here. I will just give you a short layout of core competence. What does it mean? So you need to be empathetic, even when you are answering the questions. You can use the phrases like, I will be feeling sorry about this patient, or for instance, if let's say somebody has an accident or somebody is living alone, so you will touch that part empathetically with your body language. Communication skill, again, I have talked about it. Organization and management of resources. So for instance, if the question is about like the patient, they will say, for instance, the patient has alcohol problem and we are sending the patient home. So you would know like there are different community programs about alcohol cessation, alcohol anonymous, and there is, if the patient has a risk of falls, there's a community physio and occupational therapist. So these resources, if somebody has worked in Irish system, they would know like what are the community resources little bit. But if somebody is appearing in an interview and don't have any experience working in Ireland, they should see in the again in the ICGP, they're mentioning of the community resources in a section. So ICGP website is very comprehensive, providing the information about these things. Then conceptual thinking and problem solving. When you are dealing with the scenario, you maybe just go by intuition, obviously with the background of your clinical knowledge, but there must be some element of problem solving. For instance, if somebody has chest pain and doesn't have a car, you would be thinking, okay, maybe the chest pain is not a MI, or just a chest pain and you're not sure, it's non-specific, but how is there anything you can do to help the patient to find out how he'll reach the hospital? Or you can just give a short or very brief uh, idea in the scenario. I know 3 minutes are not enough, but very briefly you can say like, okay, I have a patient with non-specific chest pain, looks musculoskeletal, or maybe I'm not sure, it's we have done the ECG, but I think patient need a serial data. So I would say like, patient to accompany as a colleague, don't drive himself. So this is problem solving, just to solve the problem of the patient and yourself, and also be safe medically. Then respect for diversity and the law, that is also important, because we would expect that because of the immigrants from different countries, because of the war and other issues, there would be, I won't be surprised if they ask a question about some immigrant, like, for instance, from Ukraine or other countries, and they could throw a scenario just like 1 or 2 years ago when we had COVID pandemic. They asked about phone consultations and COVID related questions. So just you have to just change your little style if there is immigrant related question, and be respectful that we are taught over the course of 4 years in the training anyway, but they just expect that when you're dealing with immigrants, how you proceed. Leading for continuing improvement, I don't think so they can touch that in the interview. Learning and development of self and others. So this is also part of core competence, but as being a GP who is working with the staff nurse and also non-clinical staff, their approach, how they will deal it. But I think managerial related scenarios are less likely to be there. It will be more clinical and psychosocial related scenarios, but obviously they have included this aspect as well, so maybe not, but just to touch with it. So that's really it. And going forward in the interview, when as Dr. Wakar has mentioned, you would have 2 minutes to formulate your answer. When you're doing that in your head and you are thinking about how to proceed, just be precise but systematic. And I think Dr. Aslan will talk more about what aspect we need to touch when we are reading the scenario and approaching it to respond. So that's it for this slide.
Thank you very much, Dr. Ghazlan. That was very valuable information. Having done the interview 4 times, you have a world of experience, and I hope people learn from it. I do agree, GP is very different from medical practice. There's a lot of other points that need to be taken. So it can't be taken if you've done surgery before to take it as a surgery interview. It can't be taken as if you've done medicine before to take it as a medicine interview. So this is very, very important. Our next speaker is Dr. Arsalan. He'll be speaking a bit more about the interviews. He's a second-year trainee in the SLIGO training scheme. So I'll hand it over to Dr. Arsalan. Thank you.
Thank you. Thank you so much, Dr. Adil, for the introduction. And I would also like to thank all the panelists. I second their opinion. Also, all the attendees for taking time out on their Sunday weekend. So I would like to tell my experience for the interview and for you all. What could you expect? So first of all, it would be a very friendly environment. Try to make a good rapport in the initial start. If they're introducing themselves, try to remember their names, and when you answer the questions, you can use the name, and so that they know that you're an active listener. Control your nerves. Don't be informal like me in this webinar, but try to be formal. And it's a very relaxed environment. You'll have, as other panelists have told you already, there would be 2 minutes. Don't rush. Try to you can formulate your answer. Can make some subheadings and answer very systematically. There would be usually generic questions initially, 2 or 3, and then there could be 2 or 3 questions that would be related to the patient relative communication, and there would be a question likely with a colleague. I'm not going to go into the questions that have been asked from us or from the other people, but there could be these type of questions. So sometimes they usually ask what communication skills you would use, and the core competencies which Dr. Ghazlan has spoken already. They try to use the keywords empathy, perspective thinking. I'll use the communication skills, which include perspective thinking, problem solving skills, professionalism with colleagues, empathy with the relatives. These kind of words they're very highlighted by the panelists, and they will usually pick these things. Lastly, there would be a clinical scenario. So don't assume it would be only medical emergency or a medical scenario. It could be a pediatric, surgical, gynae, psychiatry. So try to, during these interim, you can focus on all the emergencies and all other specialities which could present in the GP practice. And so, for example, chest pain, leg pain, could be acute ischemia. So just try to rule out all of things. And they would specifically sometime ask which answers would worry you. So try to maybe I'll take the history points to cover these things, so I can cover all the emergencies. Lastly, I'll be very short. So tips and tricks would be, I would say, just divide your days. Start the preparation from now. Make 3-4 days for generic questions. Write all the questions on one blank page. Meet your colleagues in the hospital or anywhere in Ireland to discuss what questions could be asked. There could be a lot of generic questions, we know. So make a list of them. Give a dedicated time to that. Dedicated time to all the questions that can be asked related to the hospital, with the patient communication, or with the colleagues. And then lastly, make a few days for the clinical situations which can be asked as well. And try to, what I did, I used to practice with my friends, and we all, alhamdulillah, got the scheme. So we used to practice with the friends, discuss the questions, try to answer how could we answer these type of questions. Take the help of a mirror. It's a good friend, and so that can be a very good. You can know how you're speaking, how you're communicating, your nonverbal skills, and that's all from my side. And if I leave to all of the attendees, if they want to ask anything, and obviously at the clinical questions, when they are asked, always safety net, always, if needed, to say that I'll take the help of the seniors, so that they know that you're a safe doctor. And good luck to everyone. Thank you.
Thank you very much, Dr. Aslan. The panel has collected these topics that you should be familiar with for the interview. I've just left the slide up there. We will open up to Q&As, but I would like to thank the whole panel who took time out on a Sunday to present their experiences, their tips and tricks. This is all to help you get onto the scheme, to help it be easier and make it better for you. So we will open up for Q&A. I would request anyone that does want to ask a question to raise their hand or put it up, and then we will go ahead with that.
While we're waiting for any particular question, is there a question yet or no?
No, there's no questions yet at the minute.
Right. So while we're waiting, just wanted to highlight what Arslan and Ghazan has already told about the core competencies. So just to emphasize the importance of those core competencies. So if there's one advice I would like to give everyone based on my experience is write all those competencies on a piece of paper, familiarize with those buzzwords, those fashionable words. Hello? And maybe write an example of your experience with, let's say, teamwork. So write a scenario where you could give them an example where you were a good team player. So write an example for each and every competency, so that when you're answering questions, you could tackle them with a personal example, and that gives you an extra point. The second thing is, the interviewers who are taking your interviews, they have a very busy day for that day. They have a long day, so they're humans, right? And they're not there to fail you. They have a checklist that they want to check you, that they want to tick mark. It's like a tick mark activity for them at the end of the day, because they've heard so many stories for the whole day and they're tired, right? So they're looking out to hear those particular buzzwords from you during your answers. If you hit those words, you get a tick mark, and that's how you score on the interview.
So if whoever does want to ask a question, I'd really like it if they'd raise their hand. In the chat group, sorry, we have one question. One is asking, is stamp 4 important for the GP scheme? And the other question is from Saad, is to find those buzzwords and resources.
For stamp 4, I could give my own example. I got GP scheme and on stamp 1, 6 months entry to Ireland. So it does matter, but just I would say don't think about stamps at the moment. It's a big achievement that you're shortlisted. Focus on the interview, and you would be able to make it, hopefully.
For the buzzword, I have just shared a link. It says Wonka tree. Wonka tree covers all the aspects of a GP, and it will give you an information what are the buzzwords we can use while answering our question. So I could give a talk on it for an hour or so. I don't want to go into that, but I have just shared the link. So please go into that, and you will find pretty much of it. Thank you.
So another question that has come from someone whose only link is T. I would request everyone who's coming and joining to please put their full names in so that we can refer to them as a person and not a letter. So T has asked, can you please let us know how to answer questions regarding the insight of GP practice?
So I think it's killing one to answer two questions at once. I think that Wonka tree and the free journal of ICGP forum, which is freely available on their website. If you start reading that every day, maybe a page of it every day, your vocabulary of GP world will increase, and automatically you will be communicating or saying those buzzwords in your maybe practice sessions in your interviews. So Wonka tree, core domains of ethical practice. It's all, if you just Google domains of ICGP or core domains, core professional domains of Irish Medical Council, you'll get those words. And if you start reading even the editorial of Forum Journal, your vocabulary for your GP interview will increase. So you will get those buzzwords. So
yeah, thank you very much. There's a few more questions. I'll just run through them. How to describe career progression from Dr. Simon Naqvi. I will say it is again, like Dr. Arslan, Rokar, Dr. Ghaznan have all pointed out, write the points and practice. The more you practice, the better you'll get at this. Another question from Dr. Asad is, I have most of my Irish experience in anesthesia, which is totally different from GP practice. How can I use this background to show my enthusiasm in GP training?
To answer this question, I have a background. I have worked 4 years in ED before getting into GP scheme. What I did was I wrote down on a Word document why I want to be a GP, right? And I use the acronym CAMP, so CAMP, clinical, academic, management, and personal reasons. So you write all those. So let's say clinical reasons. Why do you want to be a GP for clinic? What clinical reasons? It could be because you like diversity of your patients, or you want to see patients from all different age groups. You want to see patients with different conditions, chronic or acute. And you want to improve patients' health overall and not just treat diseases. So that is maybe your clinical reason. And then management reason could be because as a GP, you're a manager of your own practice as well. You manage your time, you manage your patients, you manage your work-life balance. So that could be the management reason of why you want to be a GP. And then academic reason could be because you have to have a clinical knowledge of almost everything that you can think of. Mental health, physical health, health improvement, health promotion, vaccination, all of that, and the legalities of medicine as well. So that could be your academic reason. And then personal reason could be because you have a family to look after. You want to have a better work-life balance. You want to have a better control of your hours during the week. So there's not a single answer to this question because it has to be personal to you. So maybe the acronym CAMP could help you answer that question personally, more personally.
Just to add a couple of sentences here. Thanks, Dr. Vakar. Myself, I had 7 year, experience in medicine, and I know a candidate who had who was 52 when he appeared in the interview, and he had almost finished his training in psychiatry, and he had a background of peds before that. So it's definitely tricky. If you say you have so much experience and you are switching the subspecialty, they would be curious, but apparently they won't go into much detail. Don't show that, don't explain that much. The camp is very good thing. I really appreciate Dr. Bukar to mention that, but don't show that this is your weak aspect, and just be positive and just mention literally why you want to be. I just said I just want a good work-life balance, and I think I can serve better in the community. This is what I have learned. And I literally just said, because it was my fourth attempt, and I just said whatever had in my mind, in my heart. I said I think I like the clinics the most. Instead of doing the rounds, I like to sit in the clinic and sort out patient problem one to one with patient and myself, nobody else in between. So maybe don't talk more, because more you will talk, you can make more mistakes, or maybe they can catch. But just a camp, and just briefly said I think I can serve in the community better. This is what I have seen or learned from my experience. So that's it.
Thank you very much. All very relevant information and details. Is there anyone else that does have questions amongst the participant? I'd request if they want to raise their hand, there's a function to do so, and then they can ask the question. Or if they want to type it in the chat box, that's okay as well. Pearl words by Dr. Hasan. Lovely reply. Thank you and appreciate your effort by Dr. Saad. If not, I might close the session now at this point. If there's no more questions. Sorry, I think there might be one more question now. No, just says thanks. No, at the moment, there's no other questions at the minute coming through. Yeah, there will be a link available on the IPPA website. The last slide is there, and hopefully there will be a recording of this as well. These links are there if you want to note them down or write them down, but they will hopefully be uploaded to the IPA website. May not be in the next few days, it'll be afterwards, but they will be uploaded. Dr. T is asked again, would it be negative if you want to have a good work-life balance?
Not at all. It is not negative. I don't think it's negative, or it could be taken negative.
No, it's not, definitely not, and it's quite realistic, and you can say that. But again, just speak one word. Don't go much into that. Sometimes people get overwhelmed, and they start just one word is enough: work-life balance. That's it. And if you have any other background experiences, they want to go into that, just say I think I can serve better in community. That's it.
I would like to thank the panel again before we close the session. Thank you very much for your time and effort. I'd like the panel to stay on, and we will let the participants leave just for a quick discussion. And then thank you again very much to the panel. Thank you for everyone that has participated and taken the time out of this their Sunday to attend. Thank you very much.
I would like to say, if there are any personal questions, the WhatsApp group will be open, and if nearer to the interview someone wants to do mock interviews, I think all of us will be available. Depending on our schedules, we'll try our best to accommodate. If you want to practice later on, if you have any questions, throw it out in the WhatsApp group as well, and we'll try to answer them.
Thank you, Doctor. It was really